Hi everyone, my name is Megan Higgins, and I wanted to share with you an interesting article that I found with animal-assisted therapy. And the name of this article is Effects of Animal-Assisted Therapy on Gait Performance, Respiratory Functions, and Psychological Variables in Patients Post-Stroke. And the purpose of this study was to document the effects of animal-assisted therapy using dogs on gait performance, pulmonary functions, rehabilitative motivations, and depression of patients post-stroke. And this study was interesting because it looked in their lit review of physical activity post-stroke enhances psychological and social deficits. It also addresses problems with depression, and about 30% of patients experience depression post-stroke. And physical exercise has a positive effect on managing depression and rehabilitation motivations. And furthermore, gait training with a dog while wearing an adjustable elastic waist belt, also allows the dog to walk without disturbing any balance for the person. And the trunk muscles containing, there are respiratory muscles within our trunk. And while we are walking, we're stimulating those muscles. And so gait training also enhances respiratory functions. So the information in their lit review was really interesting. And looking at their study, they assessed 30 post-stroke patients and divided these into two different groups, an experimental group and a control group. And the experimental group was the one that did the gait training program with the animal-assisted activities, and the control group only had the gait training. And the gait training performance assessed their cadence, gait speed, stride length, and symmetric index. And it also assessed respiratory functions, including forced expiratory volume in 1 second, which is FEV1, forced vital capacity, FVC, peak expiratory flow, PEF, maximal inspiratory pressure, MIP, and maximal expiratory pressure, MEP, along with psychological variables that went along with the depression, and those are assessed in two other assessments that we'll get into later. So this study, let me share my screen here. So these are the two devices that they used. So this was the gait trainer that the patients had on. This was wrapped around their waist, and the elastic band was the thing that allowed minimal resistance, so it didn't disturb the patients while they were walking and doing their gait training. And prior to the gait training, the chest straps worn by the dogs and the waist belt worn by the patients were connected using the elastic strap, which is kind of shown here. And this 140 centimeter long lead strap was made of the elastic band material. And this prevented falls, and any promoted additional safety belts worn with the waist belt. And the patients were also wearing this BTS gait walker device. And this device was attached to their back, and it helped monitor all those cadence, the respiratory rates, the stride length, and all the other like technical functions. It was pretty cool, and they were only walking about 8 feet. And then they were like turning back and walking back. And it was interesting because these give you all the technical variables, and it puts it all into nice graphs for them to assess. So the benefits of these groups, they all showed increases with significant increases with their gait patterns, respiratory, rehabilitation, and psychological factors. And these were assessed through those assessments that I mentioned earlier for the psychological factors and the depressive rates. They were measured through the Korean version of the stroke rehabilitation motivation scale, which is the KSRMS. And it was also, the depression was assessed through the BDI-2, and that's the Beck's Depression Intervention or Inventory 2. And both of those total scores went up after this, I think it was an 8-week long pre and post assessment study. And those were the significant findings of the study. And so implications for OT and why I think that this study is cool, even though it's more geared towards gait training, I think it has high applications for OT and interventions, especially incorporating that animal assisted therapy piece into this and showing that those really had high benefits, especially for those psychological factors, addressing the motivations to participate in rehabilitation and addressing depressive factors. So those are two psychological factors that really impact outcomes for therapy. So even addressing that is really beneficial for OT. And furthermore, along with functional ambulation, you could apply this towards functional transfer. So having them wearing that elastic gait belt trainer and having the therapy dog with them. And it was also shown in the study that while they were walking with the therapist, the handler was behind them monitoring the dog, and throughout the intervention, the treats were provided, but this was a task that was also graded up as the dog was positioned on the affected side. So whenever they were providing treats, they had to utilize both their affected arm and their good arm, and applying, like, having both those hands out, turning to the side, and feeding the animal. And then grading that up, they incorporated more trunk rotation into it. So this just factors that could be considered into treatment plans and interventions. So that's what I thought was interesting. Thank you.